Yes, thank you so much, Alex. Thank you all. Thank you for the invitation. This is a fantastic meeting with a lot of expertise. And yes, at KMOP, we are participating with Alex and with other partners with a big project about nature-based therapies. But also we have three group houses in the nature for mental health patients in Greece. So we have a lot of experience about the connection with nature and mental health. And EIRIANNA will provide you some more practical interventions, but I will try to provide a little bit the context, because in Greece, we are a little bit behind about the prescription of nature-based therapies and all this, the forest bathing, all these very good interventions that I see that we are doing in England and in other places. So part of our job as KMOP is to convince the policymakers about the need of these therapies and about the impact of nature on mental health, the positive impact. So very, very quickly, I will try, everyone how important is mental health, but I want to highlight, and this is what we try to convey in Greece, is that mental health is not an individual problem, can affect the families, communities, the societies. So we need to design interventions that can have an impact at all levels, not only individually, but also in the communities and the societies. So also, according to WHO, as you all know, mental health is a leading cause of disability worldwide. And that's why it's a major public health issue. And this is where we can, insist to convince policymakers about the positive impact of nature-based therapies on mental health. And of course, mental health issues have a very significant impact on economy and workforce. So let me continue with the second slide. So what are the main mental health challenges that we are facing in general, but in Greece specifically? Sorry for that. So first is the so-called climate stress. You all know that it's not only the climate change that we have, but it's the stress that is derived from this climate change. And we notice a lot of problems. In Greece specifically, we have last year huge wildfires. Already they started the fires, honestly, here in Greece this April, because we have very high temperatures compared to the normal temperature that we needed to have in previous years. So climate change is here, as you know, but has an impact on the emotions of the population. We have fear, anxiety, sadness, and anger. A lot of people worry about their future, about their properties, about how they can handle the situation of these extreme things that happen with the climate change. So climate stress is one significant aspect that our interventions need to address. The other very common, as you know, especially for children, we have a massive increase of digital use of digital tools and social media. And globally, people average about 7 hours of screen time. You can understand how this can make them very lonely, very have a fear of missing out, the fear of not be satisfied by their social environment, and also they are alienated from the nature because they're all the day with their screens, with their PlayStations, with all these things. So this is very difficult, especially for the children, to be able to stop this. This is a very bad culture, and we need to design interventions to address this significant issue. and especially when we have issues like digital addiction, depression, and lack of substantial social connections. Because as you all know, when we have very well designed nature-based interventions, we can have very good connection socially. The other significant thing is the alienation from the nature. This is very, very strong in Greece, specifically during the last years. And as you all know, we have the nature deficit disorder, as described by Louvre. We notice this a lot, especially with children, diminished use of the senses, attention difficulties, conditions, of course, of obesity, high rates of emotional and physical illness. And also we have low ecological literacy, meaning that the people do not know the nature very well. They don't protect it, of course, because they don't know the nature. Sometimes they are afraid of the nature because they confuse this climate change with the nature, right? So it's a very, very hard topic here, especially in urban areas like Athens. Athens is a big city of 4 million people, and with very limited green spaces, with very limited access to parks. So this is something that we struggle a lot to be able to apply nature-based therapies and interventions. And of course, we have the unhealthy nutrition and daily life habits because of this alienation. You all know the new trend that sitting is the new smoking, meaning that sedentary life, it's so destructive in terms of our health that has the same impact as smoking. We are sitting a lot of hours in our chairs for working, and this is the final and fourth aspect that we're dealing with is the change of the working environment. All these remote jobs, all these jobs that are in offices, we have a lot of stress, not at all physical exercise, not at all exposure to the nature. This can increase the chronic stress. We need to be always available when someone calls us, so we cannot have a lot of time to go out to the nature or to do something for ourselves. And also the pressure to succeed financially is a very, very significant limit barrier for our health. And also specifically in the Greek context, we have a lot of barriers to access to affordable and holistic care. So we don't have prescriptions for nature-based therapies. We don't have a lot of primary care here, especially for the mental health patients. That's why our organization is a strong asset, because we provide a lot of social services, including these group houses for mental health patients. So there is a lot of lack of access to primary health care. So very quickly, as you all know, nature can help us in all these aspects to decrease stress and rumination, meaning negative thoughts. We see these with our programs and with our group houses, and EIRIANNA will describe you one program. Of course, we have increased physical activity. We have increased the restoration and healing when we are in the nature, and especially when these premises, when these healthcare establishments are in the nature. And of course, we have better connection and social support. So that's why we try to have these interventions. So I will stop sharing now my screen, and I will invite EIRIANNA to continue with a project that I think can summarize all these aims and aspects that I try to present. EIRIANNA, the floor is yours.
Thank you, Vasileios. And let me also thank for the invitation, and Alex and Forest Hub colleagues. Thank you very much. It's really a pleasure to be here. So before I present the specific project that Vasileios told you about, I would like to very quickly tell a few words about KMOP as an organization. KMOP is one of the oldest civil society organizations in Greece, established in 1977. We mainly focus on 4 pillars. The first one is the field work by providing social services to vulnerable group of people. The second one is education by developing and delivering trainings and educational programs. The third one is research and innovation through the implementation of EU and national funded projects. And the last one is campaigning and awareness raising about social issues. Vasileios also referred to it. It is worth mentioning that KMOP operates 3 group houses in nature space for people with severe mental health problems. And KMOP is one of the main and primary organizations that contributed to the deinstitutionalization for mental health patients during the 80s. So we chose to focus here today on one specific project that we run in KMOP. Let me share my screen. You can see my screen, right? Okay. So the project that we would like to present to you is ecotherapy. Is a co-funded European project about using nature as a therapeutic tool in substance use disorders. The objective of the project was, because now it is finished, the objective was to strengthen the skills of mental health professionals in order for them to support people with substance use disorders. The tool to do that, how they would do that, is by introducing the ecotherapy in VET, vocational education training institutions, and treatment centers. So this project mainly focused on the training of the professionals who will then be able to deliver ecotherapy activities. So ecotherapy is a type of therapy which involves performing outdoor activities in nature, like gardening, physical activity in nature, cycling, and other activities. And its benefits can have a huge impact on the rehabilitation process of individuals suffering from substance use disorder. But as Vasileios told, despite the research that has been done in the field of ecotherapy, this method has not been yet exploited in the field of substance use disorder in Europe, so it is used as a supplementary treatment method together with the traditional methods. Before I continue, let me just ask you, do you see my screen as a presentation, or you see all of it?
We see with the notes, if you can put your presentation.
We are seeing the notes.
For that.
Yes.
Yeah.
You are showing us all the secrets that you have over there.
Which is very nice.
And yourselves as well. So let me share the correct screen.
Okay,
Yes.
perfect now, EIRIANNA.
Sorry about that. It's a problem with when working with lots of screens. Okay, so ecotherapy, as I told, is by now is used, at least in Greece, as a supplementary treatment method. So what we tried to do with the implementation of ecotherapy project was to develop training materials and interactive educational resources in the field of ecotherapy for training and therapy centers, for trainers, and for counselors. So we developed Firstly, a digital ecotherapy toolkit with exercises, methodology, and training material for the implementation of such courses by vocational trainers, and a MOOC, a massive online open course to make the training material available to a large number of interested professionals. Both tools, the digital ecotherapy toolkit and the MOOC, are two comprehensive resources designed specifically for mental health counselors, with the primary aim of providing them with the tools necessary to integrate the ecotherapy approach into their programs. So I would like to show you some screenshots from the actual digital toolkit and the MOOC. Of course, both are accessible, are free, accessible, and open if you would like to take a look after the webinar. So this is the digital format of the toolkit. So each leaf represents one module. Those are the 5 modules of the whole training. So if you click on a leaf, you can redirect it to the content of each module. The content of the module consists of different tools, meaning we have videos, we also have infographics, we also have, of course, some activities like quiz and other activities in order to make it as interactive and as interesting as possible. We also suggest 10 specific activities for ecotherapy, and all can be found in this, let's say, environment. If you click in one image, in one icon, you can of course see the description of the tools, of the activities, and of course there is the possibility for you to download the handout and use the activity, see the specific description and all the information you need if you would like to apply the activity. And the ecotherapy MOOC, the massive open online course, which is about providing training to a large number of interested professionals, as already said, it is pretty easy to log in, to enter the course. Actually, you only need to create a username and account and just log in. And again, you can find all the different modules, all the 5 modules of the course. We tried again to incorporate the interactive element as much as possible. So if you click, for example, to one flower, you will be redirected to the specific terminology, for example, about what is ecotherapy. Of course, as I said, you can find everything on the project's website, which is here. To close up, I would like to share that we chose actually to present this specific tool as it is a very practical and applicable example of how nature has a positive result on mental health. And additionally, how it can prevent isolation and also promotes social inclusion. So this is it from me.